Hi, I'm Jane Meisel. I'm a medical oncologist at the Winship Cancer Institute at Emory University, an assistant professor of medicine here at the university. I specialize in treating breast and gynecologic cancers. So I think to answer the question of how our medical practice has changed with COVID-19, I think, the kind of sudden rise of this pandemic here in the United States and here in our city has really, I think, required a lot of flexibility and a lot of thought and a lot of multidisciplinary action on the part of the healthcare team, for us, at least here at our cancer center. It's required us to try to get telehealth off the ground really pretty quickly, and to try to think carefully about what is safest for our patients and also what's safest for our providers. And I think, institutions are doing this all across the country, and I think many of us are coming up with some of the same things and some things that may be different depending on where we practice, what our patient population is like, and what our workforce is like. Some of the things that we've done here is try to go through our list of patients to decide, whose appointments can really be put off until after the pandemic peaks, who needs to actively be seen and treated now, who may need to be treated now, but who may not need to be seen in person, and who could be seen via a telehealth visit. And so a lot of triaging on the part of providers, at all levels. And then, thinking about providers, how do we keep the workforce safe? And so one of the things we've done here, which I think has worked well so far, it actually has kind of helped foster often even more of a team spirit, has been block schedules. So instead of, we're an academic institution, so typically we see patients, each of us, 2 days a week, and then have 3 days a week dedicated to research and teaching. Now we're doing these block schedules where we actually are on seeing patients in clinic for 2 straight weeks. Therefore, we're seeing our own patients, but also all of our colleagues' patients. And then we have a virtual block where we're doing only telehealth consultations and then other research activities for 2 weeks. And the point of that being that we want to not expose the entire workforce at one time. So if one clinician is to fall ill, we have others who have been home and have been unexposed, who are able to step in and fill those shoes. So that's been helpful. I think it's been a transition for our patients, because some of our patients are very wedded to their specific doctors, because we build strong relationships. But our patients also, amazing women, have been really working with the team, getting into this team spirit, because they all really want to keep us safe and stay safe themselves. So I think, at its best, the COVID-19 situation has sort of fostered an increasingly strong atmosphere of teamwork, and all kind of getting through this together. There have been some chaotic moments, but hopefully there's some lessons we can take away from this. I think, hopefully telehealth will be something that can persist even past this pandemic. There are a lot of patients who come in to check in and have really in-depth conversations, but they drive from 5 hours away. And if there's a way to safely and do well a visit via Zoom or via the computer, that would be something that's really in their best interest long after this passes. So hopefully some positives to take away from this. It's hard. I think a lot of our patients are anxious at baseline. Cancer, especially I treat a lot of young patients with cancer. Cancer is anxiety provoking no matter what. And to be dealing with cancer on top of a pandemic and, in a situation where there's also a lot of economic instability and lots of kids at home and everything else that this pandemic has brought upon society is really, really hard. So I think, on a one-to-one level, a lot of personal reassurance, talking to people about their risks with regards to COVID-19 and with regards to their cancer, talking to people about their home situations and trying to figure out, how to make the most of these things and to be as flexible with them as possible. I have a lot of patients who used to come in during the school day to get their treatments because their kids were at school and therefore they didn't have to worry about childcare. Now their kids are home, so that's not something that they have the luxury of doing anymore. So really thinking about how can we make scheduling work for them, things like that, to try to defray some of that day-to-day anxiety that just has to do with logistics. And then the larger piece of it, I think, social isolation also can bring on anxiety if you're not able to see people that you're used to seeing. That can be anxiety provoking for patients and care providers. So we've been encouraging patients, the physical distancing is important, but we actually don't want people to be socially isolated. So thinking about how can they do, catching up with friends from college over Zoom, or doing even psychotherapy or yoga through online classes and online resources, and really trying to connect people to those kinds of things. And just thinking about, advice about just structuring your day. Now that people are at home for more of the day, sometimes it can get depressing if you're just, sitting around with nothing to do. So helping people think about projects and ways that they can do things. And for a lot of patients, they found it empowering to be able to give back to. I've had patients sewing masks and bringing hand sanitizer and making their own hand sanitizer and bringing it to healthcare providers. And I think that sense that they can be part of the solution is also empowering and can help defray anxiety. So it's the different solutions for different patients, but we're trying to do the best that we can. From a patient advocacy standpoint, patients themselves probably know best what they need and what's worrying them. And to be able to articulate that as best as possible helps doctors and other healthcare team members be able to best address those issues. So if the issues are economic, if the issues are social or emotional, if the issues are with regards to cancer treatment, and should we do it or should we postpone it, or should there be, are there better ways that we can educate patients about what some of the options might be for changing their treatment around, with regards to the COVID pandemic, that would be probably helpful. I think the more communication there is between patients and providers, the more satisfied both parties are with the interaction and with the care that's given. So I think the patient advocacy organizations might be able to, one role might be able to sort of help patients crystallize what some of their concerns are and kind of share those with their healthcare teams, so that they can get the care and the questions answered that they are most in need of. I'm trying to think. I think with regards to breast cancer care, I think one of the biggest changes we've seen across the board has been what I mentioned earlier. That being that a lot of patients who have early stage estrogen sensitive breast cancer, who ordinarily might go straight to surgery, are now often starting neoadjuvant endocrine therapy in an effort to postpone surgery until a time where it's a little bit safer potentially to be in the hospital for a procedure that can be a little bit more planned. So that's something that we are actively doing as a community and are seeing. And then I think just much more concerted efforts between medical oncologists, surgeons, radiation oncologists to communicate about, what is the best approach for these patients to try to make sure that they don't compromise their cancer care in any way, but get all the care that they need in the safest way possible due to the pandemic. For patients who need chemotherapy or immunotherapy or things like that, we are essentially trying to do those exactly as we would for those who need them. But there are situations too where postponing chemo, by 3 or 4 weeks or something to be able to get out of the peak of the pandemic is felt not to be unsafe for the patient. Those are things that we might do, only after a careful conversation with the patient about how we're deviating from what we would do normally. But again, just that individualized decision making.